I saw a question here.
Yeah, I'm a board-certified addiction psychiatrist. I trained under Dr. Specker and Dr. Joe Westermeyer. He's the grandfather of all of us. We're addiction psychiatrists. And I could say this, the broadness of this bill scares me because, like you said, who gets to prescribe what is medical marijuana? There's over 400 different substances. Well, they've all pointed out the problems with what is it we're voting in. Second of all, who gets to prescribe it? And, you know, my brother-in-law is an ophthalmologist. If he does something for glaucoma, I respect what he does. But if you want me, a psychiatrist, doing somebody's eyeballs, you're nuts. The problem is, this bill doesn't say anything about me as an ophthalmologist using it for that. But my brother-in-law is an ophthalmologist. He's not a psychiatrist. And, you know, does he want to treat PTSD with this? Because that was on the list up there. Who decides what's on the list? I have PTSD. I was horribly abused as a kid. I did smoke marijuana in high school and college. And unlike Bill Clinton, I did inhale because it helped me sleep. If you look at the cannabidiol levels of marijuana, when I smoked it in the 70s, it's quite different. It stayed the same, actually, but the THC has gone up 50-fold. And that's because it's been so genetically manipulated. This, quote, natural substance is very unnatural. And it's huge dollars. And dollars are driving it in other states. And that's why the tobacco industry is waiting to jump in on this. We've opened up Pandora's box without really much science. I think both the American Academy of Addiction Psychiatrists and the APA, American Psychiatric Association, both say, why don't we make it a Schedule 2 and study it, instead of make it open Pandora's box and go all over.
And I appreciate that comment. I didn't hear a question in that. Is that correct?
Well, no, it was a statement.
I have another question.
I just gave a grand rounds on this at the Fairview Southdale Hospital last week. And I did appreciate the first speaker and all his breadth of knowledge. Has really good coverage of what the topic is. But almost nobody, like his survey from the Hampton County doctors, less than 1 or 2% of doctors actually know what that bill is.
We'll have time for one more question, so you get the last question or statement of the evening, and then we'll go on to our review of voting on things. So,
well, I was going to synopsize everything. So, no, this is going to go forward or not, with or without us. And I think as a medical bill, and we don't get to weigh in a way that's, I mean, it's happening without us. I think we really need to be a force in guiding this thing. I think that what I hear is way too broad. I think we need to make a statement on that. I think that it's getting to a Schedule 2, so we actually have some real science behind it. But there's also a lot of evidence that says it probably does help. Yet we're worried about the use, but also misuse. So it's a dichotomy, and that's because we are concerned about society as well as our patients. We have to come through with a statement that says that we're not going to be on the lam for this without some good training. Maybe not everybody gives it. Maybe only people that go through an advanced training on this thing can get their card to give the card. So I have a lot of reservations. I don't think we should deny it, but I think we better verify it.
So again, thank everybody for their questions. I would like to spend a couple minutes going over some voting with your clickers again.
Does anybody not have a clicker? Raise your hand if you don't have one. Does anyone need one?
Okay. The first question is, and she'll put it on the computer screen for me. I hope. Can you put this on the computer screen? I've got here. The clicker. Okay. Let's see if it's going to work for me. There we go. There is sufficient research to support the legalization of medical marijuana. I'll give you 30 seconds to put something in.
I'll do it. You talk, I do.
Okay. So that's the way the group here thinks tonight. 48%, about half of you strongly disagree, and I'd say 75% either disagree or strongly disagree that there is sufficient research to support this. Next question. How confident are you that making medical marijuana available in Minnesota will improve the care of patients who would qualify for its use? Again. Okay. Move on. So not very confident. About 60% of you said that not confident or just somewhat confident, with 40% saying you were confident or very confident. The third question, for what adult conditions would you support the legalization of medical marijuana? Select all that apply, then hit send. So you can do 1, 2, 5 and hit send. So all that apply first and then hit send, and this is looking at that tightening up the use question. This is one of those complex ones. Huh?
Oh, choice number 10 should be 0 on your clickers.
Ah, gotcha. I didn't understand what that 10 is 0 sounds like, Brian. We'll give you a little more time with this because it's a little more complicated. Again, you punch in all the numbers first and then hit send. And if you don't know, number 10 is what you push. You have to hit send. Either lost a few because they couldn't figure it out or they have no opinion. Okay, again, that's a very good distribution, and I can't tell which numbers are which sometimes. 18% said for severe pain, or 19%. That's the way the numbers go across.
Right, so 56% would be cancer.
Yeah, that's what I was wondering.
And then severe nausea would be 44%.
Okay. The next question is similar. For what childhood conditions would you support the legalization of medical marijuana? Again, select all that apply and hit send. Okay.
So here we have again cancer being the highest at 47%, followed by seizures at 40%.
What was 0?
0 was PTSD.
6. I'm sorry. 5. If legalized, what medical marijuana delivery mechanism would you prefer? Again, select all that apply. Okay.
We have 55% would prefer oil as a delivery device, followed by the mouth spray. I with the pill form.
In your opinion, do benefits of recommending medical marijuana outweigh the potential risks? Benefits outweigh the risks. So if you say yes, you feel that the benefits outweigh the risks.
This is for an individual prescriber, it sounds like.
In your opinion, do the benefits of recommending medical marijuana? Yes. Again, saying yes, say you feel there's more benefit than risk.
Dave, does that mean to an individual patient or as a society to society? How are you, what's the context around that recommendation?
So what is the unintended consequence of your question there?
Well, I guess it could be looking at your patient population. the risks outweigh the benefits.
I wouldn't talk about society, I think you'd have to apply it for your personal perspective
So
and your,
patient level, at a
Correct.
patient level,
at a prescribing level for you.
at a prescribing level.
Yep. Okay, so. Okay. And again, what I would read that is to say that people, that 60% of people here feel that the risks are higher and outweigh the benefit of prescribing medical marijuana. Next one. Do you support the legalization of medical marijuana as proposed in Minnesota's bill? This is going to help us bring back to our Board of Trustees and our Executive Committee for having to make a policy statement regarding this at the state legislature. We're going to go to the legislators and say, MMA representing 10,000 physicians does not support this, or does support it, has taken no stance. Go ahead. And then the last question is, the Minnesota Medical Association to support the legalization of medical marijuana as currently proposed. Yes, no, don't know. So one was individual statement, the other is an association statement. All the same. I have a question I'd like to ask, and I don't have it here, so I can't have it on the clicker, but I'd like to see a raising of hands. How many people would support the changing of the classification from Class 1 to Class 2, which would allow a more widely studied? So when I look around, that looks like about 80%. Would you agree, Janet?
See the nose.
Pardon? How many no's are there? Okay, now the no's raise their hand. Okay.
Well,
Maggie?
by definition, a class 2 drug can be prescribed.
Can be prescribed, exactly.
So it's funny because we're not consistent in that respect.
Well, except one is legalizing it in a way that is not controlled the same way. Right, I think that's where the difference is. Okay. Now, I have two more quick questions, and then we're done. One is, these are the event forum evaluations. My knowledge of medical marijuana was increased. And then the last question is how satisfied you were with this event. Are we able to get the slide set from the first speaker?
Yes, I can
And we can
ask,
put it-
I'll ask Dr. Boswick.
And we can put them on we can put them on the website?
And the summary of the legislation.
You can do that as well. And then also Dr. Resnikov's survey results from HCMC survey. I can provide those as well if needed.
I'd like this time to really thank everybody for coming here tonight. It's these forums are very valuable. We appreciate your input. And I know that some of the panelists have said they'd be willing to stick around and answer individual questions. And thank you for attending.
Mr. Moderator, nice and done.
Well, thanks for the freedom to expand.